Welcome. I'm Kathleen Haden. I'm a nurse practitioner at the University of Virginia in the Department of Surgery. And I'm so honored to be asked back again. It's been multiple years that I've been able to present for lesscancer.org on the importance of cancer prevention. And it's a real important part of my career currently, and always has been since 95, when we first started doing genetic testing, looking at a potential relationship. Did we inherit a gene from mom or dad that increased our risk of cancer? And dating back to 1995, we only had two genes, BRCA1 and BRCA2. And I wanted to explore that the next step to the most important and vital person in figuring out who needs genetic testing and how we've evolved since 1995, when some of the first tests became commercially available. I run a cancer prevention clinic to look for pancreatic cancer. So it's a pancreatic cancer screening program at UVA the last decade. And our program continues to grow as we learn about more genes that have a link between pancreatic cancer within our blood work in our DNA. And so today we're honored to have Martha Thomas, who's a genetic counselor at UVA. And today we're going to just explore the different aspects of genetic testing, specifically for pancreatic cancer, but also tie in the link related to other cancers as well.
Great.
Martha, welcome.
Morning, Kathleen. Thank you for having me.
So tell us a little bit about where we are in germline variant testing for pancreatic cancer in general.
So the easy answer to that is that the National Comprehensive Cancer Network, or NCCN, recommends germline genetic testing for any person diagnosed with pancreatic cancer. So it's really not confusing, or if you have a diagnosis of pancreatic cancer, you qualify for germline genetic testing. Also, if you have a first-degree relative that has pancreatic cancer, whether they're living or deceased, you also qualify for genetic testing. So that's a parent, a sibling, or a child that's been diagnosed with pancreatic cancer. So there's not a lot of loopholes or if-thens, then-that's that you need to remember. It's actually a very straightforward guideline.
Yeah, and it's so important that this information gets out there just for family physicians, internal medicine doctors, to really take a really detailed family history upon those visits. And it's interesting how, even though we know, how many genes are there now linked to pancreatic cancer?
There's about 13 that have a very strong, well understood link.
Right. And I guess the other important thing is there may be a pancreatic cancer, but potentially another cancer linked to it. And that's when they have to kind of put the puzzle together to look at, oh, there's a breast cancer here, or there's a colon cancer. So describe those links.
Yeah, you're exactly right. The genes that are associated with an increased risk of pancreatic cancer, every single one of them carries an increased risk for another type of cancer. So things like breast, ovarian, uterine, colon, melanoma, genitourinary. These are all cancers that can be present either in an individual or a family history that has a genetic predisposition to developing pancreatic cancer. So I think sometimes there is a tendency to put on blinders and say, all right, I'm only concerned about other pancreatic cancers in the family, when actually one person with pancreatic cancer and one or two people with breast cancer, that could actually be the indication that there could be some genetic component running through that family.
Right. And describe your role if a patient wants to come to you because they realize they may be at risk, or someone refers typically to you about the process, and then maybe talk about your meeting with them and also the difference between hereditary, familial, and sporadic pancreatic cancers.
Sure. So genetic counselors, we all have graduate degrees in specifically in genetic counseling. So we are trained, we are board certified. In most states, we have licenses to practice independently. To both explain the genetic component and do that kind of risk assessment, but then also to address the counseling needs. Unlike other areas of medicine, we can't fix genetics. You can't cure your DNA. And so learning about a genetic predisposition to developing a cancer can be a very emotional thing for a person or a family to go through. And so we can really help navigate, again, not only the medical and the biological components of what does hereditary cancer mean, what can this genetic testing tell us, but also the psychosocial of, how do you talk to your brother or sister or your cousins or your children about these results? So most of the time, it's a pretty lengthy appointment. It can be up to an hour or even longer than that. And we really go through collecting comprehensive family histories regarding cancer, sometimes other features as well, as some of these genes can present, with things like colon polyps or thyroid nodules or something along those lines. And then walking people through sort of our risk assessment, what options are available to them, and then how would we interpret the results. And genetic counselors are then the ones that call out the results to patients, and depending on how the results come back, again, incorporate that family and medical history and create a comprehensive care plan for that patient and for their family members as well.
Yeah, and that's so integral a part. Martha, a lot of times will refer to my clinic because she'll find someone that has one of these genes to talk about pancreatic cancer screening. That's so key. And it's a simple blood test or saliva test. And the other thing is...
Oh, I was going to say, that's correct. I always say
yeah.
It's a simple test that can give you a lot of powerful information.
Yeah. And it's become it's not as costly as it used to be as well.
Yeah, that's also correct. I think a lot of people have this idea that genetic testing is thousands and thousands of dollars, and it's really not. With the NCCN having such straightforward guidelines, most private insurers follow those guidelines. And so most people have genetic testing covered at or very close to 100%. The out-of-pocket cost is now only a couple $100s. So while it's not no money, it's a little easier to wrap your head around than $5,000, which is nowhere near what genetic testing costs now. Again, truly, it's only a couple of $100s. And one of the benefits of working with a genetic counselor is there's also a decent amount of sponsored testing that's going on. So for patients with pancreatic cancer, there are actually options that it is completely free, that we do not need to go through insurance at all. So I always emphasize that finances should never be a reason to not go forward with genetic counseling or testing, because there are so many ways that we can figure these things out and make it a very financially comfortable situation.
I know, that's so exciting. I remember back in the days when it was so very expensive. And it's just interesting from a psychological standpoint how if someone does test positive, talk about the aspect how it's interesting how some people don't want to test. They don't want to know.
Absolutely. That's one of the first things I say about genetic counseling is genetic counseling does not equal genetic testing. My job is truly to make sure that people have all of the information that they need to make the right decision for themselves. And if the right decision for themselves is to not go forward with genetic testing, that's actually a fine decision. As I said earlier, this can be a very heavy test for people to take, especially if they've watched family members pass away from this cancer. As we know, pancreatic cancer can be a very devastating disease, and that can be emotional to find out that you were at increased risk of developing the exact same thing you watched a parent or a sibling or an aunt or uncle or grandparent die from. And so, again, allowing people to sort of walk through those emotions and not simply do just a blood draw and make sure that they understand and are prepared is a really important part of my appointment, and something that I really focus on, because you can't unlearn information once we have it.
Right. And tell me, based on the literature to date, if it's important for people to realize, if there is a family member, it's rare that there is a germline variant, correct?
Exactly. We think that about 5 to 8% of all pancreatic cancers are due to that identifiable, that we are able to find that pathogenic variant in a gene that's running through the family. So it is uncommon. If there's 100 people with pancreatic cancer, only 5 to 8 of them will actually have that true hereditary component. But that's where you and I working together is such a great team, because then we do have, as you had mentioned before, these familial pancreatic cancer families, or familial cancer families in general, where there is a lot of cancer. There are 2 or 3 family members that have had, say, pancreatic cancer, and we've tested everybody and we can't find anything. Then they fall into that familial group, meaning that, yeah, we can't pinpoint something, but gosh, this seems a little bit more than just coincidence. And the truth of it is that we are discovering new genes all the time. So there could be a gene we haven't discovered yet. There might be some common environmental factor that all of these individuals were exposed to. It could be that there's 100 tiny little genetic factors that individually mean nothing, but in that family come together to create that increased risk. And so sometimes I can feel like a Debbie Downer when I call out these negative results and people say, phew, all right, I'm not at increased risk of cancer. I say, well, not necessarily. I still think that you could benefit by going to a high-risk clinic and sort of learning more about the options for cancer screening in a familial setting.
Right. And I think it's important in our screening programs now across many comprehensive cancer programs. We have high-risk pancreatic screening programs. We have high-risk breast ovarian cancer clinics. For every genetic mutation, Lynch syndrome clinics, Li-Fraumeni clinics, which is so exciting and such a key element for prevention, because if we find these genes, we are going to be able to screen these individuals better and potentially save lives by prevention, which is so key. And it's just still educating lay people or healthcare professionals as to the importance of screening and doing a good family history. Tell me where, in terms of genetic counseling, it's sometimes you are key, play such a key role in this, and how, one, the demand of your role, the limited role of, we need more genetic counselors, right? And how, if people see you, you're, I know in our clinic, there's issues with insurance reimbursement for people to see you. And what can we do to advocate to get more of you out there and practice?
Yeah, I mean, I think, if anything, the pandemic has sort of exacerbated how much we just need medical professionals in general. And genetic counselors really fall into that role, as genetics is becoming a more and more a part of really lots of areas of medicine: neurology, cardiac, pulmonary, ophthalmology. I mean, you name it, there's a genetic counselor that is working in some area of medicine. And that's because we really are entering that era where we are trying to figure out why things happen. And again, it's that prevention aspect, not only offering an explanation to patients and to families, but then taking it a step further and trying to prevent some of these issues that are popping up in their family members. And Right now, genetic counseling schools, the amount of genetic counseling schools since I graduated has literally doubled, which is fantastic. And I think for academic institutions to continue to support these schools to grow is really important. Most private insurers do cover the cost of genetic counseling. Sometimes there is a copay, just as you would go, to your normal provider and pay. One of our biggest rate limiting factors is CMS right now and Medicare and TRICARE reimbursement. Genetic counselors, even though similarly to NPs and PAs, we have graduate degrees and our own licenses, we are not recognized providers through CMS, which means that there is an out-of-pocket cost for these patients to see a genetic counselor. And that's something that we're really hoping to fix and address. And we do have some bills going through Congress right now. We have HR 2144 and Senate Bill 1450 going through Congress as we speak. And we've really worked. I personally have spoken to my senators and my representatives to try to encourage support for this bill because, as we know, so many people with cancer have Medicare. And it's a gap in our ability to provide really comprehensive, effective care.
Yeah. And it's such a key part, in prevention. So if I was watching this and, I notice I have my family history that's concerning, how would I go about finding a genetic counselor?
The easiest way to do that is to go to NSGC, the National Society of Genetic Counselors.org, O-R-G. And there's a big button right there on the right-hand side that says find a genetic counselor. You can search by your city, your state, specialty, and everybody will pop up. And it has our email addresses, our phone numbers. We try to make ourselves pretty easy to get in touch with. And myself, for example, I accept self-referrals. So if you were to find me online and call that number listed and just say, hey, I have a family history of cancer, I'd like to meet with Martha, they'll get you on my schedule. And so that's a very, very easy way if you are not plugged into sort of a medical home. The other thing is to ask your provider, your physician, your nurse practitioner, your PA, your nurse midwife, whomever you work with, because chances are they probably know somebody in the area and will be able to plug you in very, very quickly.
That's great. And so important. And obviously we have things at our UVA website that may be helpful. Any other last tidbits or advice in terms of, I think what I think about cancer prevention, it's a mix of multiple things. It is the way we eat. It's the way we take care of our body by movement. It's important just sleeping, right? It's important of our social and emotional well-being. And obviously removing environmental factors that potentially can cause cancer. But genetics is one of those key, proponents for that. So it's so great that we've come so far, in cancer care since I've been doing it in 1985, and we continue to grow and discover. It's kind of daunting, but also exciting. And so thank you for your work. And any other last tidbits before we sign off?
No, I think there's no such thing as a bad referral or a bad question. So if people are concerned or have questions, or if providers are just looking at a history and don't know what to do with it or whether to make, heads or tails of it, just refer. More than happy to spend the time sort of walking through and then getting any recommendations back to that provider or the patient.
And one last thing, I assume you do telehealth visits.
We do telehealth visits, and that's been a very lovely silver lining of the pandemic, is that we were really trying to grow that before the pandemic. And man, did March of 2020 just sort of push that into the forefront.
I know. It's the best thing. Even from a pancreatic cancer screening aspect, I can reach further out, and it's been such an amazing thing.
Absolutely.
Well, thank you so much for your time.
For having me, Kathleen.